The one thing I would like to say with respect to what we were talking about in terms of Easter, we really don't know when we're going to get this under control. It's extraordinarily important that we harmonize whatever restrictions we have across the country, because we have porous borders between states, between cities, and unless we're consistent, we're not going to get ahead of this thing. Still, the very best tool we have is isolation and confinement. And I think that what New York has done and Chicago's done and, some others in Washington has done and so forth have been very, very helpful. And I would like to see that implemented broadly across the United States.
All right.
We need to protect ourselves.
But let me talk about the possibility of lessening the effects of this horrible virus through hydroxychloroquine and Zithromax, that combination, et cetera. Have we done enough research in that to know whether it works? First of all, whether it would be harmful at all, and secondly, whether it would be effective across the nation?
Excellent questions. What we're trying to do now is what we call double-blind studies. This is where neither the patient nor the physician knows which arm is there, whether it's the control arm, whether there's no drug or a modification of the drug, and the actual drug that's thought to be active. Until we complete those blinded trials, we won't know, in fact, what's effective. At Columbia, we have projects that are focused on using Plaquenil, hydroxychloroquine and chloroquine, as well as plasma therapy, and we're hoping to get through those as rapidly as we can. I would just like to say on this show tonight that this has become very personal for me too, because I have COVID as of yesterday, and it is miserable.
I heard you cough. I didn't want to be a hypochondriac and say I hope you don't have it, but you do.
If it can hit me, it can hit anybody. That's the message I want to convey.
Do you know where you got it?
I know, or I think I got it, but that's not the same thing as proving it, right?
Yeah.
So, but it doesn't matter. This virus is all over the United States.
Yeah, it sure is.
You can get it.
Dr. Ian Lipkin. By the way, are you going to take any of these drugs that we've been talking about to alleviate the symptoms?
I am indeed. I'm taking one of them in about an hour's time, and I'm looking forward to feeling better. I certainly hope I do.
Who would know you were going to have to be trying these out on yourself? Well, best of luck to you, doctor. I really wish you good health. I hope this passes soon, not only in you, but in the whole country. Thank you for being here.
Sure. Bye-bye.